Hey guys, so today I'm going to give you a easy trick and mnemonics to remember and check GCS for a patient. So what is GCS? GCS means Glasgow Coma Scale. It is used to assess the level of consciousness in the patient. So it has three components like eye, verbal and motor response. It shows the minimum score of 3 and the maximum is 15. Here the V, which looks like Roman letter 5, represent verbal as 5 and either side of eyes for 4 and motor response for 6. So it's just like 4, 5, 6 scoring. Coming to the eye opening, you can remember AVPO score. So here A for alert, which means the patient is having continuous or spontaneous eye opening. You can give the score as 4. And in verbal, if the patient can respond to verbal stimuli like talking, so you can give the score as 3, and in painful stimuli like trapezius gouging or supraorbital pressure or sternal rub, the patient responds or the patient eye opens, you can give the score as 2, and if the patient is not responds to any of these, you can give us 1, which is a minimum score. In verbal response, you can have a mnemonic of oh cows no. So here O represent oriented, which means the patient is oriented to place, person and time. You can give as 5 score. And if the patient is confused, like the patient can talk but gives wrong or mixed answer, you can give as 4. If the words are inappropriate, like he or she can speak a random or unrelated word, you can give as 3. If they sound inappropriate like groaning, you can give as 2. And if the patient is not responding to any of these, you can give as 1. In motor response, remember the mnemonic old Ben. So here O represent obey commands. If the patient obey your commands or follow your orders, you can give as 6. And for L, localized pain, here if the patient pushes away our hand from painful stimuli, whenever we are giving any painful stimuli to the patient will try to push our hand. So we can give as 5. And in draws away, here the patient will withdraw or pulls limbs away from the pain. They won't try to push away our hand, they will just withdraw from the painful stimuli, which we can give as 4. In bends, abnormal flexion takes place, which we call it as decorticate posturing, where the arms are abnormally flexed towards our body. And the scoring for this will be 3. Next one is extends, which is just opposite to bends. Here decerebrate takes place, which means our arms are extends away from our body. We can give it as 2. And the last one is no response. Here the patient is not responding to any painful stimuli, so we can give it as 1.